السلام عليكم. أتمنى للجميع صحة وسلامة، وخاصة طلاب المرحلة الرابعة كلية الطب جامعة القادسية. هسه راح نكمل محاضرات الجاستروانترولوجي، ونبدي بمحاضرات liver and biliary system. So lecture today talking about the introduction to liver and biliary system. The liver is weight about 1.2 to 1.5 kg, so it's one of the heaviest organ in the body. It has multiple functions. It has multiple cells. For example, the hepatocyte forming the 80% of the liver cells. The remaining 20% are the endothelial cells, lining the sinusoid, the epithelial cells, and cells of the immune system, the Kupffer cells, and the other stellate cells. As you know, that the liver composed from two lobes. The right lobe, this is the right lobe, and the left lobe of the liver, and it is divided by this falciform ligament. And this is the situation of the liver in the body. As you could see here, the right lobe and the left lobe of the body, and you can palpate it during general examination of the abdomen. It's a unique organ. The liver is a unique organ. It has a dual blood supply. It has a dual perfusion, receiving the majority of blood supply via the portal circulation and the portal vein, which drain blood from the gut via the splenic circulation, and a minority from the hepatic artery. So as we could see here, the majority of blood supply is through the portal circulation, the portal vein, which supply the liver, bringing the nutrients from the gut for metabolism here. And this is the supply of the hepatic artery. This is the left and the right hepatic artery, and this is the hepatic vein. This is the anatomy of the liver as well. You could see here the gallbladder, the cystic duct, the common hepatic duct, the left and the right hepatic duct, and this is the CPD, the common bile duct, passing through the head of the pancreas. After it formed the pancreatic duct, had pancreatic duct form here, and drain in the ampulla of water in the second part of the duodenum. This is the right lobe, and this is the left lobe of the liver, and as I told you, that is divided by the falciform ligament. فلو نشوفها من الداخل هنا, from the inner aspect, you could see here the gallbladder and the biliary ducts, and this is the caudate loop, and this is the quadrate loop as well. The important things is the function of the liver. It has many functions, starting with the synthesis of the protein, for example albumin, coagulation factor synthesis, complement, and etc. The other function is the immune function of by the local Kupffer cells. It has an excretion function, for example excrete bile salts and bilirubin and drugs. Nutrient metabolism, very important, so it's metabolism of fat, of carbohydrate, and protein. And storage, another important function of the liver is the storage of iron, of copper, vitamin A, D, and B12. The main topics of our lecture today is about the investigation of a patient with liver disease. So this is very important. How are you going to approach of a patient with liver disease? Because investigation, it plays an important role in the management of liver disease. يعني احنا نعرف السبب, it will make it easier for us to treat the patient perfectly and properly. So the investigation, we do it, is to identify the presence of liver disease. So whether there is liver disease or there is no liver disease, then you have to establish the etiology of liver disease, and then understanding the disease severity. سامعين هواي about the LFTs. LFTs يعني liver function test. Liver function test. إيش نقصد بالliver function test? Starting with these tests, with the total serum bilirubin is very important. طبعا عندنا direct and indirect bilirubin, أو نسميها conjugated and unconjugated bilirubin. And the degree of elevation of bilirubin can reflect the degree of liver damage. فمن يصير عندنا TSP معناته البيشنت got jaundice, with degree of jaundice can reflect the degree of liver damage. Second important things هو enzymes, liver enzymes. You have two important enzymes, ALT and AST, أو سابقا كنا نسميها SGPT and SGOT. طبعا ALT is more specific for liver cells. So expression of ALT outside the liver is relatively low, and this enzyme is therefore considered more specific ALT, SGPT for the hepatocellular damage. Then you can send the patient for serum albumin, لأن احنا قلنا إنه الألبومين may be synthesized in the liver. Other important test is alkaline phosphatase and gamma GT, gamma glutamyl transferase. The main site of production of alkaline phosphatase حقيقة هو بالliver, but we have other sources for alkaline phosphatase. الالكالاين phosphatase يطلع من ال GIT, من gastrointestinal tract, from the bone, from the placenta, and from the kidneys. So you have مثلا osteomalacia, you could have a high alkaline phosphatase. If the patient is pregnant, you could have high alkaline phosphatase. If the patient have kidney disease or gastrointestinal disease, you could have high alkaline phosphatase. But the main source of alkaline phosphatase is in the liver. الجاما جي تي يفيدنا هنا حقيقة when there is نسميه احنا الدرug او enzyme inducer drugs. When there is enzyme inducer drugs occur during ingestion of microsomal enzyme inducing drugs or during ingestion of alcohol. ايضا بالنون الكوليك فاتي ليفر ديزيز يفيدنا الجاما جي تي. فاذا high alkaline phosphatase is very important in assessing liver function test, وعادة it reflect when there is an obstruction. فمن عندنا obstructive jaundice او عندنا cholestatic jaundice مثلا gallstone او tumor راح نشوف very high alkaline phosphatase. Other important test is the coagulation test. احنا مثل ما قلنا ايضا one of the important organ synthesized coagulation factors هو liver. فمن عندنا liver disease راح يصير عندنا defect in coagulation test and coagulation factor formation. طبعا احنا مثل ما نعرف عندنا extrinsic pathway وعندنا intrinsic pathway. اهم شيء حقيقة هو الاكسترنسيك باثوي اللي نقيسه بالبي تي يعني بروثرومبين تايم اللي بيهن الفيتامين كي ديبندنت فاكتورز فإذا coagulation factor tests, these are often abnormal in patients with liver disease. The normal half-life of vitamin K dependent coagulation factors يكون طبعا short 5 to 72 hours. فرأسا يبين عندنا prolongation بالبي تي من عندنا liver disease. وطبعا هذا مهم بالنسبة لنا as a prognostic point of view, and so changes in prothrombin time occur relatively quickly following liver damage. يبين رأسا these changes provide valuable مثل ما قلت prognostic يعني point of view prognostic information in patients with both acute and chronic liver disease. Increase PT evidence of severe liver damage. فمن عندنا PT prolonged معناته عندنا severe liver damage. فيتامين كي هنا النقطة المهمة يعني مو كل patients عند PT prolonged راح يستفاد من الفيتامين كي supplementation أو giving vitamin K only when there is obstructive jaundice. من عندنا obstructive jaundice فإذا vitamin K does not reverse this deficiency if it is due to liver disease. لأن هنا المشكلة بالliver بالformation of coagulation factors مو بالفيتامين K absorption. فمن عندنا PT prolonged due to obstructive jaundice هنا طبعا vitamin K is beneficial and useful. الأذرز هو السي بي سي نسوي لهم احنا البيشنتس any patient with liver disease نسوي له سي بي سي يعني complete blood picture. راح نشوف ممكن normochromic normocytic anemia. طبعا احنا one of the important cause of upper GI bleeding هي الاسوفاجيال varices اللي تصير بالliver disease. فإذا عندنا مثلا bleeding due to esophageal varices أو peptic ulcer disease مريض ممكن يصير عنده normochromic normocytic anemia وممكن hypochromic microcytic anemia إذا أكو عندهم iron deficiency anemia. إذا chronic blood loss فإذا أكو acute blood loss يجي المريض عنده normochromic normocytic anemia. وإذا chronic يجي hypochromic microcytic anemia secondary to iron deficiency anemia. أيضا ال size of the RBC increase نسميها macrocytosis يعني high MCV والhigh MCV نشوفها due to alcoholism أو due to liver disease macrocytosis. Leukopenia decrease in the leukocyte count طبعا due to هنا portal hypertension. ايش راح يسوي لنا splenomegaly يسوي لنا hyperspllenism and engulfing of white BC, RBC and platelet. فاذا من نشوف leukopenia it could be a manifestation of hypersplenism. او ممكن leukocytosis اذا عندنا مثلا infection خاصة اذا اكو cholangitis او alcoholic hepatitis او hepatic abscess. Thrombocytes very important. platelet count ايضا يصير عندنا thrombocytopenia اذا عندنا hypersplenism طبعا. اول شيء affected بالhypersplenism هو البليتلت، فاول شيء ينزل هو البليتلت كاونت فيصير عندنا thrombocytopenia. وطبعا كل ما ينزل البليتلت كاونت indicate يعني worsening of liver function. لذلك البليتلت level are usually more depressed than white cell and hemoglobin in the presence of hypersplenism in patient with liver cirrhosis. We have other tests. For example, you could send the patient for serum sodium, blood urea, serum creatinine, serum ferritin in patient if you have hemochromatosis. Other important tests were immunological test and liver autoantibodies. You can send the patient for anti-nuclear antibody, anti-smooth muscle antibody, anti-mitochondrial antibody خاصة إذا patient have مثلا primary biliary cirrhosis. Very useful, very beneficial. In this disease you can send for immunoglobulin, for ferritin, alpha-1 antitrypsin, ceruloplasmin if you are suspecting for example Wilson disease. And أيضا عندنا هسه الفايبروسكان. Nowadays you can use fibroscan to assess the liver stiffness in patients with hepatic fibrosis.